My name is Dr. Margaret Flowers, and I serve as Congressional Fellow for Physicians for a National Health Program.
Dr. Flowers, one thing you said this morning, you answered the question about how do you sell this to all the people who oppose and are yelling socialism?
We actually say that what this is that it's government-financed health care and it's privately delivered care. So it's public financing because we know that by financing our health care publicly, we actually can use our health care dollars the most efficiently. It's about health, not about creating profit. It creates a situation in which the people have a say over how the health care dollars are used. And some people, and then on the delivery side, it's actually the same privately, like Medicare, where we pay for it through our taxes, but you can choose what doctor you want to go to. They're still private in their private practices. Some people call it socialized medicine. That's a myth. We call it civilized medicine. It's what civilized nations do for their people.
You talked also about how we're actually spending more in healthcare per person now, but would spend less with single payer. Could you talk a little about that?
Sure. The only area where the United States really excels when it comes to healthcare is that we spend the most per person per year on healthcare, and that's because we have a very fragmented, market-driven, wasteful situation. So we're spending twice as much as many of the industrialized nations who actually, with that money, cover almost everybody and have better health outcomes. Single payer creates a system where it's very streamlined. It's one system, one set of rules. It's easy for patients. It's easy for health professionals, but it cuts out what we're currently doing, which is wasting about a third of our healthcare dollars on administrative and marketing costs. That goes away. That means that we're saving about $400 billion there, which goes to pay for care for people. And it actually allows us to have built-in cost controls like the ability to negotiate fair prices for pharmaceuticals and services that we can't do right now.
A lot of people are saying let Obama's bill take its course and see if it works. How do you answer that?
Well, we already know how it's going to work. We've tried this at the state level. It's something that's been tried, and we know that it doesn't work. We know that the healthcare costs, the reports that came out after the bill was passed show that our healthcare costs are going to rise more rapidly under this reform. We know that it's going to fail to be universal. Tens of millions of people are going to be left out. In addition to that, we're already seeing its demise because over the past year, the Health and Human Services have had to give out waivers to businesses and insurance companies who can't comply with the law. They actually have a 24-hour turnaround on their waivers to exempt people from the provisions of the law. So it's already deteriorating. What we say is we know that we haven't solved the fundamental problems, and so with the amount of suffering and death that is occurring right now in this country, it's our responsibility to keep pushing for a solution that we know is evidence-based, that we know will work.
The other problem people talk about is for the for-profit side of it. How do you explain to people that taking away the for-profit is really cost-effective?
Well, the for-profit part of our healthcare payment it's about creating profit for themselves, and the way that they create that profit is by denying and restricting care, by trying to only insure people who don't actually need healthcare services, and they employ lots of different tactics to avoid paying for care and avoid having people that are sick that they insure. So they don't do anything for us. They don't add any value to our system. They just actually add obstruction to our system and add cost to our system. We don't need them.
And I think you mentioned 23 million Americans will still be uninsured after Obama's bill takes effect.
That's a low estimate of how many will still be uninsured. Since the legislation has passed, the numbers of uninsured have jumped quite dramatically because of our economic downturn. And in addition to that, the legislation provides waivers for people who can't afford to purchase insurance, that are forced to purchase insurance. So we anticipate that with this economic downturn, there's going to be a lot more people that can qualify for those waivers and will be exempt from even having insurance. So I think that's a low estimate.
What about the tax credits? Could you talk a little bit how people can't afford the tax credits that's supposed to pay for their health care?
Well, tax credits have been tried. They just don't work because, for one thing, many of the people that can't afford to pay for health care are in the population that isn't even paying taxes, or requiring people to pay up front and then maybe get a tax credit later, they just haven't worked in the past.
And what about states who have now asked to be exempt from Medicaid? What are going to be the ramifications of that?
Well, this is a huge problem because actually half of the 32 million that they were estimating would get coverage under the new reform are estimating coverage under Medicaid. But Medicaid is financed at the state level primarily. States have to balance their budgets. Most of our states are facing deficits. They're not able to meet the requirements of paying for Medicaid, so that means that they're going to have to restrict either services or restrict who they can give Medicaid to. It's a huge problem.
The legislation says that if states can show that they can provide affordable health care, they can get the waiver. What is meant by that affordable health care?
Well, that's an interesting question because in Massachusetts, what they defined as affordable health care was not actually affordable to the people of Massachusetts. So this is why it's just really important for us as people to be clear in what it is that we require and to be very vocal about making sure that health care is affordable. We know that this has been tried, that their definition of affordable has not been affordable, and so we know that under a single payer system we can actually provide comprehensive universal health care at a cost that is affordable to people.
And one last question, how do you plan, or how do you want to plan to kind of have a national single payer? What can we do now with the healthcare reform so entrenched? How can we move that at a national level?
Well, there's a couple of key things that we can do. I mean, one thing is that we do have the national bills being reintroduced this year in the new Congress, and so we will need to get new co-sponsors for them. So this is an opportunity for people to meet with their members of Congress and let them know that they want them to support this legislation. And more than support it, we want them to actively support it, which means joining a single-payer caucus, which means speaking about it when they're out speaking in public. And then the other key things that we need to do is to educate ourselves and the others around us. That's very important. And then we need to get organized. And so that's part of what the effort is here today, is that encouraging people to start their own groups in their own communities that are meeting regularly and educating themselves about this, finding ways to bring more people in and ways to get the word out. And it's going to have to come from us. The one thing that the reform process showed us is that if we leave this up to Congress, they are so controlled by the corporate interests that the legislation does not serve our needs. It serves the needs of the corporations that are profiting off of the current situation. If we want real change, it has to come from us, and that's being clear and being uncompromising in what we're asking for.
Anything you want to add that I haven't asked?
Just if people want to get involved or want to learn more, there are some national websites that they can visit, and so that is www.pnhp.org and also www.healthcare-now.org. You can get information about the proposals that we support. You can also find out about what campaigns are going on, and you can find contacts for local leaders in your community so that you can get involved with them. So this has got to be from the bottom up, us coming together in solidarity, joining to fight for economic and social justice, and healthcare is part of that.
I read your letter to Obama. Did Obama ever answer your letter?
No, he didn't answer my letter. I was actually arrested trying to get the letter to President Obama. Fortunately, Bill Moyers invited me on his show after that, and so it did turn out to be an opportunity where we were able to speak to a broader audience, and that was a positive.